Good afternoon, attendees. Thank you for joining us this afternoon. We're going to allow some time for our attendees to join us. Please know that this webinar is being recorded, and we do have ASL interpreters available for our attendees throughout the entire presentation. Welcome. If you are listening to us by phone today, or you have joined us by phone, we ask that you please, if you're able to type your phone in the chat, type your name in the chat, you could do that, or you could send us an email to nmvvrc@musc.edu with your full name and email address so you can get credit today. I do see 2 people have joined us by phone so far. Okay, Ann, I think we're good to start.
All right, good afternoon to all, and good morning to our friends joining us from the left coast, Hawaii, Alaska, and around the world. And welcome to the National Mass Violence Center's 10th National Town Hall. Today's town hall focuses on how to create a coordinated, survivor-centric community response plan for mass violence incidents. By the end of this presentation, you'll truly appreciate this timely adage: by failing to prepare, you are preparing to fail. Here's some interesting facts about today's convening. We have 344 registrants representing the United States and 4 other countries. Registrants are across 38 states, territories, including DC and Guam, and more than half work in victim survivor services. Sadly, 61% have lived in a community that has experienced mass violence. And of those who have, over half, 53%, responded in a professional capacity. So we have lots of lived experience among our attendees today. And I also want to note that today is the 2-year annual observance of the mass shooting at the Tops Grocery in Buffalo, New York. And our hearts go out to the survivors, victims, and the entire community of Buffalo today and always. Next slide, please. Quick housekeeping announcements. It's being recorded and we have live ASL interpretation. We're so grateful for that. Closed captioning is available to you if you go to the setting at the bottom of your screen and turn on closed captions. They are also available in multiple languages. After being posted to our website, the recording of the town hall, the slide deck, and an incredible resource guide will be available for download on our website. As Claudia said, if you're joining us by phone, make sure we get your name and email address. And we want to thank so many of you who sent great questions to our presenters in advance. We are going to try to save as much time at the end to answer the most frequently asked questions. We have 5 learning objectives today. We want everyone to recognize the importance of advanced preparation and to be able to list the agencies, the organizations, and the professionals that you need for effective planning and response, as well as what the different professionals do. We're going to talk about the 16 best practices of emergency response. We are going to describe amazing technical assistance resources available from our center and our partners that can help support your coordinated community response planning. And last, we're going to determine the most important skills and strategies needed to create that coordinated survivor-centric community response plan. We have a great lineup of presenters today, and if you go to your registration, you'll see longer bios. I shall be brief. Eugenia Pedley is the Senior Program Manager for Mass Violence and Terrorism at the Office for Victims of Crime within the U.S. Department of Justice. She is our guiding light at the National Mass Violence Center, and certainly to all the communities that have been and continue to be impacted by mass violence. Elizabeth Cronin is the Associate Academic Program Director at our center. She is working with the ICP TTA Preparedness Division. And until very recently, in just January, she was the director of the New York State Office of Victim Services. Eric Gall, who has so many initials after his name, is a very impressive consultant to our center. He's a distinguished technology expert and has a comprehensive background in public safety, emergency management, counterterrorism, and organizational resilience. And Dr. Angie Moreland currently serves as the Associate Director of the whole National Mass Violence Center. And beginning in October, she became the Director of our new Improving Community Preparedness Division of the National Mass Violence Center. We are very, very grateful to Kelly Marsh and to Courtney Workman, who are providing ASL English interpretation today. And it's always my great pleasure to introduce Eugenia Pedley to you. Welcome, Eugenia.
Thank you so much, Anne, and I'm really pleased that I can join all of you this afternoon. Today, we're going to talk about not just how to develop a mass violence response plan, but ensure that these plans emphasize the survivor experience. I do wish we never had to talk about mass violence again, that no one else would be hurt in any way or witness these horrific incidents. That's not the reality that we're living with, though, as the 2-year mark of the Buffalo shooting illustrates. These events will happen again and again and again, so we need to be prepared to help those who are affected by these tragedies. We know from surveys that our National Mass Violence Center has conducted that these events have a tremendous impact on broader communities and not just those directly impacted by them. From community surveys in 3 locations, we know that past year and even current PTSD was 5.5 times higher in El Paso, 4 times higher in Parkland, and 5.3 times higher in Pittsburgh than the national average. We also know from a small sample of survivors and witnesses of the 2017 Las Vegas mass shooting 4 years after the fact, that over 49% had past year major depressive episodes and just over 63% reported past year PTSD. Those who were physically injured had even higher rates of depression and PTSD. I'm mentioning this to hammer home the broad and enduring impact these events have on victims and communities alike. These events are a big deal in people's lives, and ignoring them will not make things better. Planning will. Today, you're going to hear about the importance of preparing for these incidents and having a coordinated response. Speakers will also share some lessons that they've learned along the way. We don't want just planning, we want effective planning. The presenters talking today will take you through important points and show you some resources that are available, including support through the Improving Community Preparedness TTA project that was mentioned earlier. While every mass violence incident in each community is different and survivors' needs vary tremendously, there are still things we can do to make survivors' experiences better on what is very likely the worst day of their lives. So thank you for being with us today, and let's get started with our program.
Thank you, Eugenia, and thank you for reminding us of the wide scope of the impact of mass violence incidents. It is a big deal in people's lives, and we always have to remember that. So thank you so much. Now we're going to hear some messages from lived experiences. And for the incoming 2 video clips, please feel free to adjust the volume on your computer as needed. We'll start with Greg Mullen.
Hi, my name is Greg Mullen. On June 17, 2015, I was the chief of police in Charleston, South Carolina. On that evening, a self-radicalized white supremacist entered the Mother Emanuel Church and killed 9 beautiful people, changed the lives of 5 survivors forever, and sent shockwaves through our city, our state, and across the country. I learned a number of things to that response. I'd like to share a few of those with you today. First of all, I think one of the most important aspects of our response was the fact that we had worked so hard previously to build positive, strong relationships with our partners all across the region. This was not only public safety partners, but also those in the victim advocacy, clergy, mental health providers, and others that could surge resources and provide us with their expertise should we need them in a mass violence incident. And I believe that during that incident, our response demonstrated all the hard work that we had put in prior to it occurring. Secondly, we understood very clearly the importance of having a robust family and friends center or family assistance center process. We were able immediately and simultaneously to the response to activate our family assistance center and utilize the resources that we have been working with for years and partnering with through associations, collaborations, and other initiatives. One of the other things that we learned very clearly was that when you establish your family and friends center or family assistance center, it's important that this not be an afterthought. It has to be part of your planning. It has to be part of your incident command structure. And you need to have someone designated to operate that center and make sure that all things necessary are being completed. It's important that the people there are trained, that they know exactly what they're supposed to do, and they have the expertise to exercise that when they're asked to do so. And finally, one of the things that you will see in any mass violence incident is there's going to be chaos. There's going to be all sorts of things happening in your community at one time. It's not just going to be the response from the police or the fire or EMS. It's going to be all types of needs that occur within your community. And what you want to do as a leader is you want to make sure that you have the ability to try to put some order to that chaos. What I would say to you in terms of creating an opportunity to be as prepared as possible for a mass violence incident that might occur in your community is that, one, build those strong relationships, build them now, build them in a non-crisis environment so that when you do find yourself in crisis, they will come together and they will provide you with the resources and the needs to help your community on the worst day it's ever had. Secondly, practice, understand, and utilize the Friends and Family Assistance Center process, and make sure that you've got the appropriate resources that are trained and the positions are staffed that can provide immediate resources and commitment to those that need it most. And then three, please practice the things that you're going to need most during a mass violence incident, which is structure. Make sure that you understand how that process is going to work, how you're going to integrate different agencies, and how you utilize that to bring order and as much calm as possible to those who are going to be responding. Because as you can put the order in place, it's not going to create a situation where there's no chaos, but it's certainly going to help you to provide some calming effect to those that are responding and others around you. So what I would say most importantly is just make sure that you're doing everything that you can now, because it's not an if, it's a when this is going to happen to your community. And the way that you're going to effectively respond is to do everything you possibly can to prepare yourself, your organization, and your community today so that when the incident occurs, you'll be as prepared as possible. Thank you.
And thanks to Chief Mullen for giving us a great foundation for today's discussion, which is build positive, strong relationships now. And we'll go on to our next lived experience. Dr. Deborah Hauer-Burton, victim advocate extraordinaire from Florida.
Hello, my name is Deborah Hauer-Burton, and I am a retired law enforcement victim advocate with over 35 years of experience. I have also had the privilege of responding as a national crisis responder to numerous mass violence incidents over the years. Therefore, I just want to share with you some of the things that I think will be beneficial as you prepare for mass violence incidents, and they are my 5 Ps. The first P is people. Please, in advance, get to know the people who might be involved, whether it's the media, law enforcement, other victim advocates, the FBI, the medical examiner. Now is the time to start a coalition so everybody will know what each other's responsibility is. The next P is place. Location, location, location. Start now looking in your communities where people will be able to meet that's going to be big enough. So you will be able to have a central meeting place. The next P is politicians, the political climate. It is your responsibility now to know who the stakeholders are, whether it's national, local, your sheriff, your mayor. Know who the political stakeholders are. And therefore, you'll be prepared when they come to the scene and you'll be able to give them the information. The next P is provision. Do you know if you have enough water? Can you get water? Can you get snacks? Can you get food? Make the necessary provisions right now. Last but not least, patience, patience, patience. I cannot definitely tell you how much patience is. Everything is changing. So if you're not a patience person, now's the time to definitely get more patience. My 5 Ps are people, place, political, climate, provision, and patience, patience, patience. I want to tell you that if you prepare in advance, you'll be able to effectively manage a mass violence incident, understanding that things are fluid and they're changing all the time. But if you prepare in advance, what could go wrong will go wrong. I guarantee you that you will be more effective in how you prepare for mass violence incidents. Thank you so much.
And we are so grateful to Dr. Howard Burton. I'm going to say for the 6th P, her practical advice. That is so valuable to us today. And it is now my pleasure to introduce to you Elizabeth Cronin.
Hi, Anne. Thanks so much. And thanks, Eugenia, for your opening. Welcome, everybody. It's a little unusual for me to be on this side of the town hall. I'm usually one on your side listening and watching. But I'm thrilled to be here and to have this opportunity to talk about my experience and also what we're doing with the National Mass Violence Center. So, I mean, this may seem somewhat obvious, but in communities that we've been talking to, there's so much emphasis on responding to an event. If there's a mass shooter, of taking, action against the mass shooter. But really, everything that we all are doing is about victims, survivors, and families. And there's nothing more important, which is why all mass violence planning has to take into account trauma-centered therapy, trauma-centered response. Next slide. So it's sort of somewhat of a coincidence, but today we're honoring the memory of those who we lost in Buffalo on May 14th of 2022. And in my former role as director of the New York State Office of Victim Services, we responded very quickly to that event. And I see that there are a number of my former colleagues from OVS and also from the Buffalo community who are here today. And it's so important that we keep the victims, the survivors, and their families front and center when we're talking about how we're going to respond to an incident of mass violence. So, as I said, a lot of times, we're thinking in terms of preparedness as one of emergency management. And in many, many communities, and I saw this in New York, that there was a lack of focus on including victim services into the preparation. And even, looking at a community like Lewiston, Maine, for example, that suffered terribly last fall, there were a number of therapists that were available to assist victims and survivors in the community, but that there weren't necessarily a lot of trauma therapists. So we have to be thinking really broadly about what our preparation and our process is going to be, and who do we need to both have at the table, and what resources do we need to have available for recovery. If we're looking towards getting people to resilience and recovery, we need to know what we have, what the gaps are, and then how do we go about getting those resources in place. So it's sort of a trope, but saying that, all events, all incidents are local, and that's certainly true in a mass violent event. And It's the same way when we're talking about preparedness, that it has to be based not only on what your local resources are, but it has to be based on what your local needs are. And it's, it's sort of obvious to say that every community is different, every event is different. But when you can't always anticipate everything that you're going to find when you are responding to a particular area, but you have to know, what is the culture of that area? What are the resources that are available? A response in Buffalo, a response in Lewiston, Maine, in Colorado Springs, in Parkland, Florida, are all going to be very, very different because of the nature of what happened, as well as the population, as well as the resources. And so you need to know, when you're making a plan that is trauma informed, that you have to know exactly who you are going to be inviting to the table and who needs to be there in order to make sure that all the needs are being met in short term, middle term, and long term. So, as I said, every mass violence incident is different. Every community is different. All the survivors are different, and the resources that you may need are going to be different. So you have to do an assessment of, where you are, how things look, what you have available to you, who are the best people to be at the table. As Deborah just said, you have to know who are the people that need to be involved in this, and what are the things that are going to help this particular community that may not be relevant or effective in a different community. So, as I said, we responded to the tragedy in Buffalo, New York in May of 2022, and I spent a year and a half traveling back and forth to Buffalo in order to assist. And I will tell anyone on here who is a state administrator, there are an incredible amount of resources and help available to you when something like this happens. And immediately Eugenia will reach out to you, which has happened to me a number of times, because in New York, we had a number of incidents, unfortunately. And usually Ann Seymour from the National Mass Violence Center will reach out as well to say, we're here, what can we do? And now, because we have this added component of ICP-TTA, that Dr. Moreland and me and the rest of the staff, we can be there to help communities before anything happens, to help you work through a program that will allow you to have what you need available if in fact something happens. I know Chief Mullen had said, if it's not a matter of if, it's when. Let's hope that it's not ever when for anybody else. But I hope there are some takeaways where you can learn from us who have been involved in these incidents or have had to respond. So just taking a quick look at Buffalo, and I'm using this as an example because it's a more recent event in my experience, but also it really has a lot to do with the response that came after. So the city of Buffalo is known as a very segregated city, and this is the population breakdown. Next slide. So the east side of Buffalo, which is where this occurred at the Tops supermarket, has a predominantly Black African-American community, and 85% of Black Buffalo residents live on that, on that east side. And one of the problems that has plagued that area of Buffalo is that it was disinvested for a very, very long time. And it led to a lot of community distrust of the system, and it led to a real lack of resources that might be available in a different community. It also had higher rates of crime overall, and this meant that there were a lot of people in the community who went into this incident with a lot of trauma already. So this was a shooting by a white supremacist who murdered 10 people, injured 3, and then left many, many people who were there, but not physically injured, but clearly emotionally injured. And the person was arrested at the Tops Market. And it was, there was some anger in the community because the person had all these weapons and then was taken into custody and had not been shot. And there was some questioning, why this person was able to be taken alive. So there was a lot of obvious anger in the community over what had happened. And it was clearly a hate crime. This person had targeted this community. He had selected East Buffalo because of the demographics. He had done surveillance of the area prior to this and chose a date and time, a day and time that would maximize the amount of people that would be out and about. Next slide. So when you're looking at your readiness to respond to an event like this, every organization that's involved in a response is going to be doing something a little bit differently. Their mandate is going to be handling a different piece of everything. But the problem is that a lot of times organizations and agencies basically stay in their own lane. And so when you respond to, or when you're thinking about how you're going to go into a community and work with them, you really have to think a lot ahead of time about who are you going to be working with, both at the state level, maybe the federal level, at the city level, and then the county level. And you need to understand, and that's why I put up some of those, the demographic figures, is you have to know the dynamics of the area. So for example, my former agency, we funded 12 programs, 12 victim assistance programs in the city of Buffalo, which is fantastic. None of them were in that neighborhood. And that only became really clear to us when we responded. The programs stepped up. They were terrific about helping in the response, but they were not of that community. And as you can imagine, when people are the victims of a hate crime like that, they're going to be very reticent about allowing people from other parts of even, the city and the state to come in and to respond. So, one of the things you have to be thinking about is, when you're going to mobilize, who are you going to take, who's available, what stuff do you need, where are you going to go, who are you going to connect with when you're there. We had prepared, but, we had go kits, we had a lot of materials available to us. But it's, when something happens on a Saturday, you have to sort of figure out who's available, who's going to be able to go with us. And when we got there, we determined that maybe the group that we brought up with us did not reflect the community, and we were going to have to change who we were going to be sending up there as the days and the weeks went on. So a lot of it is finding out. We were lucky because we had funded a program at the Erie County District Attorney's Office, a crime victim advocate program. And so we were able to immediately reach out to them. And the DA's office did an amazing job in this response. And honestly, I think that they should get a lot of credit for helping to organize a lot of the help that came in there. So, we had to deal with all the different parties that responded. The FBI came, obviously the state was there. We had our Homeland Security, our Office of Mental Health, all the local partners, the county executive, the mayor's office, a variety of different organizations. Plus, we invited in the National Organization of Victim Advocacy to help us navigate at the original resource center. That was something that I think the community did not have, was an idea of where to put a not the Family Assistance Center, but the Family and Friends Center, in order to draw where people were going to be able to gather. So here, of course, it was compounded by the fact that in the top shooting, the place where most people did a lot of their daily business, whether it's paying bills, getting a bus pass, getting cash, doing grocery shopping, all of that was stopped because this building was no longer available to them, and no one would want to go in there anyway. So all of those services had to be accommodated, and that's not something that you would normally see. We also funded a program in the street outreach program called SNUG. It's throughout the state, but in Buffalo, we had done a lot of work with them and had funded them to hire case managers and social workers. So we were able to immediately connect with them in addition to the DA's office, and we were able to be with them. They took us into the community. They are trusted messengers in the community, and therefore it gave us an entree that we would not have otherwise had. And as Chief Mullen said, no matter how much you prepare, it's always chaos, but it's a chaos that you can manage if you have the right preparation. So just some lessons learned. Victim services has to be part of the planning and preparation. And when I was at OVS, I would send a letter out every year to all the local OEMs and say, this is who we are. Here's a list of all the programs in your county. You need to put them on your planning committees or working groups because they will assist you in providing services to these victims who are going to be looking for that through someone, and they have the resources available to assist them in the short term and the longer term. I think it's important that you understand that you have to be flexible and adaptable, that you're always going to go into a situation which is kind of unknown, but there are basic parameters, as Angie is going to talk about in a few minutes, that will help kind of organize how you're going to approach the situation. The other thing I would just stress is, obviously all these family members who lose someone, all those victims who were present, all those victims who were injured suffer the most, but the entire community suffers with this. And that continues today in Buffalo and many communities that have experienced mass violence. And so, this is when you are planning or preparing how you're going to respond, you always have to remember that this is going to be a long-term investment, that it's not going to be get in, get out. Whether it's putting together the Family Assistance Center, whether the Family Assistance Center then becomes the Resiliency Center, it's going to be driven by the community, and it's also going to be something that you may have to be working on for a very long time. So, some of these are pretty basic, knowing who you have there, who you need to bring in, and remember, there's always going to be a lot of conflict. I haven't seen one that doesn't involve conflict, but you have to remember that this community is traumatized. And I think what we learned in Buffalo was that even the people who were doing the responding, who were the helpers, they were all traumatized too. And so we have to be very careful about what burdens and responsibilities we place on people or ask them to do, because they are also going through a trauma. So this was a memorial. Today they were establishing the actual memorial, but this was at TOPS. And the community really came out to show support for their neighbors. And hopeful. And this is a picture of the 10. And what's interesting, I found this article about there's this unheard of drop in gun violence last year, saying that community leaders are saying it's not any one thing, but it's mostly grassroots efforts. there's a tremendous amount of grassroots organizations in that community and many communities around the country. And you really want to be able to identify what those programs are ahead of time and how they can be useful in a response like this. And lastly, I just want to end on a hopeful note. This was at the 1-year commemoration. We were sitting at an event with the governor in the parking lot of Tops, and at the end of the ceremony, this was what appeared above us. And I think we don't get a lot of thanks in doing this work sometimes, but that's not why we're here. And we're here to see things that give us hope about how these communities will not only survive, but at some point that they will be able to thrive. And I just would end by saying, what Angie is going to talk about is really what this organization can do to help any community, whether it's a school district all the way up through the state, to prepare to handle something like this. So thank you.
Thank you so much, Elizabeth. And your advice to get to know your community, that resonates with mass violence planning, but just think about being in victim services and behavioral and mental health and allied professions. Knowing your community is just essential to all of the work that we do. So I appreciate that advice. And I'm so excited to welcome Eric Gall, because we've had so many questions from the field about how do victim services break into emergency planning and be part of the solution. And I think we're going to hear some good tips from Eric Gall today. Welcome, Eric.
Well, thank you for that warm welcome. I appreciate it. So let's move into the slides. Dwight Eisenhower said, "Plans are nothing and planning is everything." What exactly did he mean by that? Well, you could put out an email and ask people around you or people people in your professional orbit for mass violence response plans, and you could do a lot of copy and paste and global search and replace, change the name on the cover page to your community. But that's not really going to help you, because in the long run, the planning process itself, the interaction that you have with the other people that need to come together to create a mass violence response plan, that's where the learning takes place. That's where the muscle memory gets fine-tuned. And it's a function of talking about how you're going to interact, how you're going to respond, who does what. It's sitting across the table and knowing the people on the other side of the table, hearing what they have to say, that creates an excellent plan. Because otherwise, what you get is what we call shelfware. You get something that's 120 pages long, it sits up on a shelf and it collects dust. And it doesn't do anybody any good to pull that plan off the shelf of the day of or the day after a mass violence incident and sort of brush it off and try and figure out what's in that plan, who does what, who do we call, who do we notify. That stuff has to be automatic. And the only way that it's automatic is by going through the planning process. So my first takeaway for you is don't just put out an email and ask your friends for copies of their mass violence plan and then copy and paste and think that you've checked that box. So how do we prepare? Well, what I've copied here is the FEMA preparedness cycle, and you can jump into that cycle anywhere you want. But, if we start out at the top right, under plan, and we'll go through the planning that I just talked about, the next phase is to organize and equip, is to actually get the go kits into people's hands, is to make sure that people have the computers and the radios or the cell phones, the clipboards, whatever it is that they need to stand up a family assistance center, to be able to do after the incident whatever they're going to need to do. So then they're not scrounging around at the last minute trying to find what they need. So organize and equip those people. And then once you have the equipment, you actually have to go out and train everybody on the plan, train them on their responsibilities under the plan, train them to work laterally so that if Eric can't show that day because he's on vacation, that you have somebody else who can take over and move laterally and assume those responsibilities under the plan. So training is absolutely essential because, again, you don't want to try and brush off the plan and say, this is what we got to do today. You want people to really know that. Next, you want to exercise. Oh, go back, please. Thanks. Next, you want to exercise, and that is really, really important because it's not just enough to train it. You have to put people in a situation where they're actually going to go out and do their role either as a tabletop or perhaps out in the field. Set up a family assistance center, get out the forms, work through activating whatever kinds of computer software you need to do intake, and work through those bugs, because the safe place to make those mistakes is during an exercise, not during the day that you actually have to perform those. And then after the exercise, you walk away with notes about how you did, how to evaluate, how to improve what you did, and that feeds back into your plan. So take that information that you gather and go and talk to your local emergency manager, because this is what emergency managers do. If you talk to them now during what we would call peacetime or blue sky, on a blue sky day, then you'll be prepared to move forward on a gray sky or a black sky day. Next, please. So there's an aphorism in the emergency management community, and it is that it's better to exchange business cards before the emergency. Literally exchange business cards. Get to know people. Look across the table. If you're not intimately familiar with the police chief or the police lieutenant or the head paramedic or the coroner, talk to those people so that you know who they are. So when they show up on the scene, you're not trying to figure out who they are. Instead, it's a, hey, Bob, good to see you. Jane, nice to see you. Sorry we have to meet under these circumstances, but at least you already have that working relationship well in hand. So exchange those business cards before the emergency. So I've put together some lists of people that you might want to work with. This is not an exhaustive list. This is the best Eric could come up with for who I think you need to work with. But let me start at the top with the chief executive. You need to incorporate the chief executive, elected official of your jurisdiction in your plans. They are going to be thrust into a situation where they are going to have to be the cheerleader in chief for the community, where they're going to have to make decisions. They're going to have to get out in front of those cameras and show leadership. And if they are not intimately involved in the plan and understand what it is and understand who the players are, they're not going to look good on camera. They're not going to be reassuring, and they're going to feel like that perhaps you let them down. In my mind, the next most important person is your emergency manager. Now, I say that because I'm an emergency manager, but emergency managers, as you'll see in a minute, we're the conveners in chief, and so we want to be at the center of all of these planning activities, hand in hand with everybody who needs to be there. Obviously, an incident where there are a lot of fatalities is going to require a coroner or medical examiner to determine the cause and manner of death. And so they're going to have to be involved as well. And they're going to bring to the table legal requirements and legal responsibilities to be aware of, because they're going to have to maintain custody of evidence. They're going to have to, have the victims' bodies processed in a way that gives them the ability to then later testify in court. Hospitals, obviously, not everybody's going to die, and so you need to be able to treat the injured. You need to be able to treat the walking wounded, and all of those people who are secondarily or tertiarily related to the victims, because they are going to become patients or victims themselves. The mental health providers, I don't need to tell you about. This is, your bailiwick, and you need to be intimately involved. And we'll get to how you get involved later in the question and answer, because I saw one of the questions coming up. I also want to put in a plug for reaching out and involving forensic specialists. There are going to be incidents that occur that require identification of remains, identification of victims. And if you don't have forensic specialists involved, you may not be able to do that correctly. And for closure for families and loved ones, correctly identifying individuals is critical. And I've read accounts of people that have been shown their loved ones or theoretically their loved ones, and say, that's not the person that I know. And it's horrifying, and it amplifies the pain and the trauma that they suffer. So bring those forensic specialists in, so that they're working with you from the beginning. Funeral directors as well. There's a funeral director association, and I highly recommend that they be involved in any kind of planning, because they're going to be the experts in how you handle and transport and maintain the remains of people that have been killed in a mass violence incident. Public Works is very, very important. They're going to do traffic control. They're going to provide fencing and barricades if you need to be on the scene for a long time, perhaps a vehicle removal, and then finally restoration of the public space. And then obviously, for any kind of incident like this, you're going to have your public safety first responders, fire, EMS, law enforcement, and I think we all know what their roles are there. But these are the people that you need to have at the table so that you're all working through the plan together. Next, please. So I want to go back to for a second and tell you the 4 C's of what emergency managers do. We're the behind the scenes people. We're not in front of the camera. We're not the ones that are rushing in where everybody is running out. We're the second responders, if you will. And we convene, communicate, collaborate, and coordinate. And in convening, we are experts at bringing people together, bringing a wide variety of stakeholders together to talk and to give their input and to arrive at a consensus plan. We're also experts at communicating. So we're the ones that send out the alerts using whatever alerting system your community has. We're experts at working together across agencies to affect a plan and to make sure that that plan works. And then finally, on the day of an incident, to coordinate all of the different resources that come in, all of the different people who come in, tell them where to go, tell them what to do. We're the coordinators. We're not the fire chief or the police chief, giving the tactical directions. We're the ones that work behind the scenes to make all of that work. Next slide, please. So these are some organizations in addition to the National Mass Violence Center, of course, in addition to FEMA and the Department of Justice, but they're organizations that I think could be helpful to you as you go through the process of planning. There are websites that they have. I've listed these websites here. And all of these websites, if you search on mass fatality incident or mass violence incident, you'll come up with the specific place on their website that they can give you assistance. And while state hospital associations and local community hospital associations have too numerous websites for me to potentially list, I did want to put them in the list here because you really should be reaching out to them, because that's going to be probably your single point of coordination to reach into the formal medical community and get plugged into the wide number of hospitals in the community that can assist you with treating patients and working through the healthcare aspects of things. So that's what I've got, and look forward to answering questions later.
Thank you so much, Eric, and also for introducing me to the term shelfware. I've not heard that before, and y'all don't want a dusty old plan. You need a plan that is practiced. And you also made me think that about the value added that victim services and behavioral mental health professionals bring to crisis response. And thanks to Eric, we now know who needs to know about our value, and that is on slide 35 when you get the slide deck after this presentation on our website. It's a super important slide for you all to remember. So thank you, Eric. And now I am thrilled to present my colleague, Dr. Angie Moreland. Hi, Angie.
Hello, thank you. Thank you so much for having me. And thanks, Elizabeth and Eric. Great presentations. So I'm going to give a little bit of information about the National Mass Violence Center. Many people who are on the town hall today have been to some of our other town halls, or perhaps may know about the National Mass Violence Center and some of the resources that we offer and some of the work that we've done and activities that we've conducted over the past several years. But with the preparedness side, many people may be a little bit less familiar. So on the overall National Mass Violence Center, as many are aware, our focus is to develop and provide evidence-based programs, services, and strategies, basically to identify and meet the needs of a range of individuals and communities who have been impacted by mass violence. We are very skilled, and one of our major expertise areas is in the behavioral health and mental health impact of mass violence exposure. But what we're talking about today is what you do before a mass violence incident occurs. Many people have said today that we talk about when it occurs. We say all the time that we would rather be wrong in that direction. We would rather say when and it not happen than to say if and be wrong in that case. So for our preparedness side is really built to build and sustain partnerships to help build that preparedness that Elizabeth and Eric talked about in their presentations, and how important it really is to prepare for a mass violence incident, and just make sure that your community is ready, so that, as was said before, if you never have to use it, that's okay, but how can we be ready? So we provide ICP TTA through the National Mass Violence Center, and this is specific to individual communities and sites. And we offer a range of different services with TTA, so I want to highlight a few of those. It's basically assisting communities, and by community, that could mean individual communities, so that could mean kind of in a small sense. So small towns, small cities, and then all the way up to the state level, helping people to develop their partnerships, their policies, and their procedures to help prepare for those needs of victims. And then also expand the capacity of agencies and governments by providing supplemental resources. So one of the main activities that we conduct and that we do at the Mass Violence Center is to establish resources and to promote those resources and really disseminate those resources widely. So we're able to do that on the preparedness side as well. So just some of the activities that we have been working with communities to conduct is webinars, trainings, so both virtual or in person, case studies and scenarios, review of emergency response plans. So I loved Eric's beginning of his talk about, not just sending an email and not just having a plan ready. A lot of people do have some plans ready. Now, whether that plan incorporates mass violence fully or whether it incorporates victim services, that's at varying degrees. But that's one of the services or one of the technical assistance areas that we're able to offer communities is to actually review those emergency response plans. So we have several consultants and several people both on our team and also on our consultant and partner networks that are very skilled in this and really have worked both in communities in the response side, but also really worked with communities in building those plans and building victim services into those plans. So that's one of our options. And then also both short-term and long-term TTA. So understanding and really honing in on what Elizabeth said at the beginning, that every community is a little bit different and every community has different needs and also has different experiences. So the landscape of where that community starts in their preparedness plan is going to differ very, very much based on past experiences, based on sociodemographic factors, based on many different areas. So to be able to go in, conduct a needs assessment of what is needed in that area, and that could be short-term technical assistance, and it could be long-term, depending on what all is needed. There's many phases of victim assistance, as you guys have seen, many of you, this graph before. And today, obviously, we're talking about the planning phase for preparedness. So what can you do ahead of time to help plan and help to prepare for an incident? The best practices have been noted earlier a couple of times. These best practices were first developed by ICF, an organization who really did a lot of really great work in building up what is needed for communities. So this obviously isn't going to be comprehensive. There's no way for everything. That's for anything to cover absolutely everything. But this is pretty close. It covers many of the best practices of if you're stepping back and saying, what do we need to do to prepare? Here are 16 areas that we can hone in on, look at, and really cover to find out how prepared your community is. So from a needs assessment standpoint, but then also building in trainings, consultation, and review of plans to make sure that these components really are being addressed, because they are very unique to mass violence incidents. One thing that's often noted to us, and I think Eric said this as well, or someone kind of alluded to it, is that most places have some type of plan in place. So most places will say, we're prepared for disaster, or we know what to do in crisis. Our communities dealt with crisis before. And I think it's very important to comment that that is true in many communities, and many of the preparedness plans and many of the activities that are already laid out in communities for disaster and for other types of crises will work for mass violence. However, there are very unique components of mass violence and unique components both of victim services and what victims need that really do require to hone in on what those plans are and how they specifically address mass violence. So it's a start to have some of those, but these 16 best practices really hone in on what is unique to mass violence. So I'm going to give just a very quick overview of what these best practices are. This can be a full day presentation or a full day kind of workshop. So obviously I'm not going to get through all of that in the next 10 minutes, but wanted to give people an overview. And this hopefully will give people a toolbox or a glimpse into our toolbox as far as in your own community, as you're thinking about your plan, as you're thinking about what you have. Do these components, are they included? And these are areas that you may want to reach out to us and figure out how you can more comprehensively address all of these. So incident command, most people have heard of incident command. It's a common organized structure used by emergency responders. So it's basically to aid in the management of resources during response to incidents. What's very important and what's unique to mass violence is in building a preparedness plan for mass violence is very important to ensure that victim service is built into this incident command framework. So that is very rare that it's built in, and making sure that, as Elizabeth said, there will be chaos when a mass violence incident occurs. But if you've already thought ahead to how victim services will be built into that incident command, you will eliminate a little bit of that chaos, at least in how that trusted response is there. So you will know who to trust. You will know how it fits into this command framework. The second best practice is committee identification and engagement. So really identifying these key allies ahead of time. So Eric mentioned having business cards, knowing people, having those connections and building that trusted support, and also having met already to discuss some of the things that could occur and some of the areas that could become crisis and could become chaos during a mass violence incident. So once a plan exists, meeting not necessarily often, but as often as possible, to maintain relationships, ensure the plan is up to date so that when an incident occurs, these committee members are activated and people know exactly who should be in the room and exactly who should be on the phone moving forward and what they do and their roles. Up-to-date contact list. This sounds very obvious. Unfortunately, it often does not happen. So people retire, people move, people go on vacation. People have all different reasons why they may not be available when a mass violence incident occurs. So making sure you have this contact list of key responding agencies with backups. I cannot highlight that enough. And having an activation process. So knowing what will be the mechanism to notify and how will that start? Who needs to be contacted and by whom? A family and friends center. So this is immediately kind of the first 24 hours is this very first established center. So it's reliable, validated information can be provided at this family and friends center. Right after an incident, it is extremely chaotic, as we've said, and very overwhelming. So victims need to know what happened, where they can go, and how they can access support. So making sure that you know where that will be, because it happens very quickly, where they can receive just-in-time services. A victim identification and notification protocol. So making sure that we are aware that mass violence incidents involve multiple victims. There's multiple casualties, multiple fatalities potentially, and figuring out how we are going to handle this victim identification and notification. Most communities have some type of protocol for victim identification and notification because other crises tend to happen, but it is very different when there's massive numbers of missing people and when there's a lot of identification and notification needed all at once. Number 6, public information and crisis communications protocol. Information is the most valuable resource following a mass violence incident, even if the information is that we don't have a lot of information right now. So people want to know what's happening and they have questions. And if you don't provide the answers to those questions or don't provide some type of update to what's happening, they will fill in the blanks or they will assume the worst. So you really have to understand and have laid out exactly how this communications will take place. And what the platform will be, who will be identified, and make sure that people are trained in that. And also thinking about the media, including the media in this, including people who post on social media, and figuring out what to do and have a plan ahead of time. Volunteer management protocol. When a mass violence incident occurs, a lot of volunteers come to help, which is a good thing. So you want people to help. However, you need to have that managed ahead of time and know exactly what to do so that you can make sure that the volunteers are managed appropriately. People have very good skills and people want to offer those skills. However, too many volunteers showing up and not understanding how that will be managed can cause a lot of chaos and a lot of additional crisis. A family assistance center is the center that's established right after the family and friends center. So this is after the first 24 hours and basically exists until a resiliency center or until a longer term plan happens. So we really need to have plans for this ahead of time. So this is something that we have a lot of different resources and a lot of consultation services to be able to help communities figure out how this family assistance center will be set up, how people will have access to this center, and how we will refer people to areas, organizations, any type of place to meet the needs that are needed, both in the short term and in the long term. And the coordinated case management really begins at this family assistance center. It tends to be the hub where people go to receive all of the case management that they may need moving forward. Financial management. A lot of people donate immediately following a mass violence incident. That's one of the first things that people often notice is all of the GoFundMes that come up, all of the organizations, all of the people that want to donate money, goods, basically anything that could be helpful to communities following a mass violence incident. However, that can be very, very overwhelming right in the aftermath of an incident. So figuring out ahead of time how this financial management or how these donations will be managed, already having talked about how a designated 501c3 will be made to manage these funds, how will we take these funds, and kind of what will happen and how will it be distributed is very important to think about ahead of time. Memorial and special event planning. Elizabeth talked a little bit about the memorials and special events. It takes a lot of conversation and a lot of planning. And one of the things that we often hear in the preparedness or in the planning realm is that it seems a little ahead to start already thinking about memorials before an incident even happens. But it's important to remember that spontaneous memorials immediately occur. And the more that you've thought through memorials, those spontaneous or those longer term memorials and special events, the more you've thought through those, you're already kind of one step ahead and have already built the foundation to help decrease some of the anxiety and some of the stress that can happen following an event. Behavioral health response. Mass violence incidents are extremely traumatic for victims, families, and the entire community. So there are a lot of needs from a behavioral health perspective, as people would assume right after an incident. It's very important to understand that it's short-term reactions and that these behavioral health reactions last a very long time. So it is not the right time to think about what to do about behavioral health the day after an incident. You already have to think about where are the gaps in your community? What is the roadmap for behavioral health response? And how can we already start to identify those gaps and make sure that we have a plan for what to do after an incident? First responder support. First responders need a lot of support following an incident. And just like with behavioral health response from the last slide, as we talk about with individuals and communities, we need to already be thinking about those first responders. So they're the first to enter a scene and they're the last to ask for help. So if we are doing them a great service if we can already think about what supports, and as Eric mentioned, all different types of first responders and what do we have in our community and what can we already be built up and be training in so that we're able to provide that support when needed. Planning and preparedness grants and emergency funding assistance. There are numerous grants and financial resources available to support victims and communities after an incident. So already researching and knowing what is available, even if you have it in your toolkit ready to go to after an incident, the more research you've done ahead of time, that's the last thing you will want to do after a mass violence incident is sit down and figure out funding. So already knowing that ahead of time places you at an advantage. Community resiliency planning. So this deals with resiliency centers. So resiliency centers reflect the desire for communities to provide healing, health, and support to both victims and the communities in the long term. So already thinking about resiliency center, already thinking about where this would be, how can we start to identify what is available in our community and what could be available at a resiliency center, you're already placing yourself, like I said before, at an advantage. Criminal justice system and victim support. This isn't always necessary. Many times the defendant is not living after an incident, but if the defendant is not deceased or is living, then victims and family members will need support. We have we call it in short the NMVC court guide on our website that really walks through this criminal justice system and victim support. So at the very least, already accessing that court guide, reading through it, and having it as a resource for if needed afterwards. And then lastly, just highlighting or saying again what Eric said, the need for training and exercise. Exercises are a key component of preparedness. It really provides an opportunity for the whole community to come together and multiple different partners and roles to come together, do exercises, have joint trainings. There's an ICP-TTA exercises guide that assists communities incorporating victim services into emergency management. There are a lot of great resources out there, and that's one thing that we're happy to assist with is pointing people in the right direction for some of those trainings and exercises. Eric's slide was a lot better than mine in that it really talked through some of those main components of partners and planning. This is a more comprehensive list in thinking through what partners are needed to engage in the planning process. So these are just some of the people to think about already in that planning. And then a bonus best practice is really thinking about news media and social media. So mass violence victims and survivors need support from trained VSPs to help explain. So really knowing that VSPs can explain the positives and the perils of social media to survivors. They can help them decide whether or not to limit exposure. We have 7 tip sheets specific to victims in the media and 2 podcasts that specifically talk about media. So that is an additional kind of best practice. The bonus is go ahead and think about social media and really engage victim service providers in how they can help with this.
Thank you, Angie. Oh my goodness. I want to remind everybody the 16 best practices require practice. You don't want them to become shelfware, my new favorite word. And I just want to remind you of, Angie just spoke about the best practices, which do give you a roadmap, but make sure you check in and download our resource guide, because as she was talking today, I just kept thinking about all the resources we'll have listed for you after the webinar that really support the 16 best practices. So thank you, Dr. Moreland. And we are going to ask our 3 presenters just to give us one strategy or skill so that people can really think about creating a coordinated survivor-centric community response. And I'll go ahead and start with Elizabeth.
Thanks, Anne. I think what I would focus on if you are in victim services is creating community with emergency managers. I think Eric touched on this as well, but sort of enroll emergency managers in your vision about how providing robust victim services will ultimately help in the response and in the recovery of the community. Don't discount what victim service providers can do for emergency planning.
Oh boy, that is such important advice. Thank you so much, Elizabeth. And we will go to Eric. One strategy or skill, please.
Wow, one. That's no fair. I really think that the strategy or skill that I would encourage everybody to develop is your ability to network and to be confident in yourself, to feel like you've got something valuable to share, and that you are going to demand a voice at the table and insert yourself where needed so that you can speak up for people that aren't going to be in a position to speak up during or after a mass violence incident. And so that requires being comfortable introducing yourself and working your way into those discussions.
Yeah, Eric, thank you so much for that, because I think victim advocates are historically really good at inserting ourselves because we're not always invited to the table. And what I'm hearing you say is that the partnership with emergency managers is just essential to this whole planning process.
And we'll welcome you with open arms. And if you find an emergency manager who doesn't, let me know who they are, and I'll make sure that they do the next time.
All right, Eric will be taking names, y'all. Thank you, Eric. And Dr. Angie Moreland, what is your one strategy or skill, please?
I would say even if you feel your community is prepared to handle disaster or other crises, it's really crucial to consider those unique components of mass violence. So make sure that you educate yourself, learn about those unique components, and incorporate those into your plans really early on. So basically yesterday.
Yeah, thank you, Angie. And I remind people, if you go to our website, nmvvrc.org, we just have boatloads of information that can help you with the planning process. And we will go to our next slide. I just want to remind people that you can request a consultation or technical assistance for free from the National Mass Violence Center. And you can take a picture of this slide, or you can download it later from our website. There's 2 different emails for consultations, and then one specifically for the technical assistance related to preparation. So do contact us. We want to make sure that we hear your needs and hopefully can meet them. And now we have enough time, which is very unusual. We were not rushed today. Yay. I really want to thank everyone. There were such thoughtful questions that were submitted in advance, and we kind of mooshed them into 5 or 6 that I hopefully we'll be able to get through quite a few of these today. The first one, I'm going to give this to Dr. Moreland. Angie, how do you identify and proactively engage the large number of mental health and behavioral health professionals that are needed for the effective response, and not just right after the mass violence incident occurs, but as you mentioned earlier, for the long term, finding people who know what working with victims is all about?
Yeah, that's a really good question, Anne. And I think that really highlights the importance of this planning when we talk about that best practice around behavioral health, is knowing your community ahead of time. So we know in the mental health field, we are at a shortage. People hear all the time about wait lists and how difficult it is to engage mental health services ahead of time or at all. And with a mass violence incident, you not only need mental health providers and services, but you need people who are trained in working with victims, so who are trauma focused providers, and also who are evidence-based, so are going to do the most effective services for trauma victims. And this can be for one-on-one individual mental health assistance, but also just support programs, all different types of needs that victims have following an incident. So I would say knowing ahead of time where your gaps are in your community. Do you have providers for children? Do you have providers for adults? And what does that look like? And also looking throughout your state, even if you don't have them, local in your community, what is available, and already having kind of that roadmap of what is there, that will set you up already to kind of know. But then after the fact, knowing and being aware that, as you just mentioned, it's not in the short term. In the short term, most people probably will not seek mental health assistance. It's once you get into that middle to longer term that people start recognizing, I may really need help, or I may need this type of help. So understanding that you can identify people right away. And a lot of time people will come out of the woodworks and will want to help right away, but knowing that it's not just right away, it's going to be for the long term that's needed.
And thank you for reminding us, Angie, that a lot of survivors do not immediately seek behavioral mental health services. It is going to be farther down the road. And so to really be thinking of this in the long term, really, really important. Thank you so much. Boy, the next one I think I'm going to give to Eric. Eric, in preparation initiatives, what are the best practices to integrate the fire department, EMS, emergency management agencies that are kind of system-based with victim services and behavioral mental health professionals who tend to be more community-based? How do you moosh these two groups together? Oh, Eric, I think you're on mute.
You would have thought that 4 years after COVID began. I think it goes back to the business card thing. It's recognizing that, the fire department's busy, the police department's busy, and you're going to have to go and knock on their door and say, I'd really like to sit down with you guys and talk about, how you would respond, how we could incorporate our services into what you're doing, meet with the emergency manager, and start the ball rolling. If those agencies are not coming to you, you need to go to them and say, I have resources, I have, skills and knowledge. And my experience, having worked in all of those fields in fire, police, EMS, and emergency management, is that we all recognize that we're not the experts in this area. And we really appreciate it when people come to us and say, I can help you, because everybody that's involved in these areas wants to do the right thing on game day.
Yeah, and Eric, when I think about it in my lived experience, there's a role for the emergency management, fire, police, and everything. We have a separate role that's so critical, and I never understand why people don't get it. But I hear you saying we need to help them understand that we bring the value added to mass violence preparation and planning.
Absolutely.
And if they're not nice to you, I'll let Eric know and he'll go after them. Okay, thank you, Eric. All right, I'm going to go to Angie and maybe a little touch Eric on this one. Good question. How can we effectively integrate hospitals and healthcare systems into our preparation activities? And what is their specific role in contributing to a survivor-centric community response? And Angie, I'll let you head this off. And Eric, please add anything you think is important.
Yeah, I think the first piece is to consider them, to have them a part of those plans, a part of those conversations, a part of those business card exchanges, as Eric said. We tend to, think of the hospital sometimes as separate. However, we forget that that is the that's where the victims are going immediately after. And they have a lot of great protocols in place to be able to accept victims and to be able to really work through crises and work through some of the aftermath that happens right after a mass violence incident. So making sure that they are a part of the conversation, a part of the response, but then also knowing that there may be trainings that are necessary. So we may need to talk about, they're very, very skilled and have a lot of training. And obviously this depends on which healthcare system, it varies, but in working with the immediate aftermath, that's what they do. But in helping them to understand that it is much longer term with mass violence, given the number of victims that are often there, the involvement of the community, just those unique components that I talked about before. So making sure that we're integrating them in the process and also knowing that we may need to assist them and knowing kind of what those victim needs may be and how they can be survivor centric. And I'll turn it over to Eric to add to that too.
So yeah, I would add that if you look at virtually any kind of large scale incident, and it doesn't have to be a violence incident, it can just be a natural disaster, technological incident or something like that. People present themselves to hospitals outside of the 911 system. They don't wait. And we saw this happen in Las Vegas with the Route 91 incident. So people show up at hospitals and so that means that they haven't been triaged, they haven't been assessed, they haven't been recognized, accounted for by the system. And so a hospital may think, well, I've got 12 patients coming to me through 911, but actually at their emergency room door, they've got 30. And so I think it's really important for planning purposes to make sure that you incorporate the hospitals and the hospital associations in the planning, because they may not recognize the tidal wave that they're going to be hit with. And it's not just going to be people that show up that have, glass injuries or shrapnel or bullets or what have you. It's going to be people that show up who are, mentally traumatized by the incident, who have relatives and who don't understand, well, I was in the neighborhood and I got affected by this plume of smoke and I think I'm dying. The psychological trauma that they're going to undergo, even though they were not direct recipients of the violence or the incident, doesn't negate the fact that they're at the emergency room looking for help.
Right. Thank you both. And I just want to add, we've been fortunate since we began in 2017 to have the American Hospital Association as one of our partners to the National Mass Violence Center. And their Hospitals Against Violence, or HAV program, and their webpage just has wonderful resources that we have co-developed specifically to mass violence preparedness and response. And so it's a great resource for everyone on the webinar here today.
And could I add one thing to that too?
Of course you can.
We had an incident, a terrorism incident in New York City, and a lot of people were going to a particular hospital. So we reached out to our advocacy program that we funded there. And the hospital had never contacted them. So they had this resource right in the hospital of victim advocates, and there was no communication between them. So it underscores how important it is to engage the hospitals, to let them know how those programs can be utilized in one of these.
And when you think about it, hospitals have SANE nurses, they have chaplains who deal with people who have experienced trauma and victimization, and they a lot of them kind of have a clue about the value added that we bring, and so engaging them is really, really important. So final shout out to our partners at American Hospital Association. They've been just amazing over the past 7 years with us. And Elizabeth, I'm going to give this one to you, and I want to say I'm grateful to the Office for Victims of Crime, because during Victims' Rights Week last month, I learned a lot about credible messengers, which I didn't know about, people who are already within and trusted by the community. And Elizabeth, what's their role in mass violence preparedness?
Well, and interestingly, if you remember last year's National Crime Victims' Rights Week, Jerome Brown from Buffalo actually got an award from OVC because of the work that he's been doing. So essentially, I mean, this is a model that's been around for quite a few years. In New York, we call it SNUG, which is gun spelled backwards. And it's part of a program that was started through the Division of Criminal Justice Services that funded these SNUG programs throughout the state where there is the most violence, most reported violence. And they are people who are in the community. Often they have been justice involved, and they have a credibility with the community. They're trusted partners. And so their role is to go out when there's a shooting and sort of work both sides, where they work with the families of the person who was shot, as well as the family of the person who did the shooting. And so it's to sort of take the temperature down so that there isn't retaliation. But we saw a need in those programs. First, we had them all trained in victim compensation, because people, in some neighborhoods, were not coming to our funded programs for compensation. So we trained them to help people with it. And then we worked with DCJS to provide funding to them to hire case managers and social workers in those locations. And that had a double benefit. One is they were there for the SNUG workers, but they were also there to assist victims, and not just with gun violence, but with domestic violence, everything. And it was a resounding success. So when Buffalo happened, that was one of the first calls I made, because we have such a close relationship with them. Jerome, having been from Buffalo, although he's not there anymore, he knows everyone in the community. So he helped us in a variety of ways of getting access to people, of getting information about local programs that we weren't aware of. So I use that as an example to say, there's things that when you're planning, you might not think of as a resource for you. But in the end, they were probably one of the most important resources that we had available to us up there.
Thank you, Elizabeth. And I would encourage everybody. I'm an old dog, so when I learn a new trick, I get pretty excited. Look up credible messengers, because I really see them as part of the future of our field, but specifically for mass violence. We learned in Buffalo and other communities, they do play an important role. So find out who your credible messengers are. And we've got time for just one more question. And Elizabeth, I'm going to ask you to take the lead. Anyone else jump in? After a mass violence incident occurs, how do the local response teams coordinate with the state and federal response teams? You have layers and layers of people who are going to come in and lead and help. What's that look like?
I think it depends on where you are. So we had responded to a number of incidents in New York City. And as you can imagine, they are a well-tuned machine. And so, we knew where we fell within the response strata. And those were much easier to navigate because everybody had a specific role. And, they have it kind of all set up. With some communities that aren't, it depends. So you really have to take every community the way you find them. For some communities, the mayor's office might be the point. It might be the county executive's office. It might be the emergency manager. So it's important to work with your state partners. So for us, for example, the Homeland Security Office has the relationship with all the local emergency managers. So it's important to coordinate with them on, what is your role as a state VOC administrator, for example? and how you can galvanize the local victim assistance programs to assist you in that response. Another way that is something that we were looking into when I left was to offer training in critical response or crisis response team training, and then have those folks who have been trained to assist you when there's mass violence, especially if it's in their community. I think it's important, to the extent that you can, to utilize local resources, because you'll have much faster buy-in.
Right. Thank you. Oh, go ahead, Eric, real quick.
I just want to throw in one quick thing, and that is, in the emergency management community, we have something called EMAC, which is the Emergency Management Assistance Compact. And if there's an incident that occurs in a community, in a state, and the resources need to come from outside that state or outside that community, emergency managers can get those resources tasked at the local, state, and federal levels. And so they're a really good resource for you.
Right. Thank you so much, Eric. And I've got to do a very quick wrap up. When the National Town Hall ends, a survey is going to magically appear. We really, really appreciate if you take just a few minutes to complete the survey, because it helps us improve our town halls. And the last thing I want to say is our next National Town Hall, number 11, is scheduled for August 22nd, 2024. We do not have a topic, so if you have some suggestions, we're happy to hear them. I want to say thank you to our amazing presenters, to our ASL interpreters. We're very grateful to you. And I just want to end with a quote from General Douglas MacArthur. He said, "Preparedness is the key to success and victory." Worked out pretty well for him. So think about preparedness as your most important tool for success when you're looking at mass violence preparation and response. Thank you all. Thank you, OVC. We're grateful for you. Thanks to our amazing team and speakers. And thank you to all who attended. Good afternoon.